Dr. Pannozzo is the one you guys need to call, and make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Good morning, everybody. I hope everyone's having a good Sunday. First, I want to say hi, Colleen. Our lady, I will take all your calls and make sure that we're on time.
What's the number?
Oh, which number do you want? You want the number? Okay, 1-800-889-0267. If you suffer from any kind of pain, call in and let us hear. We challenge everybody. Colleen doesn't screen any calls. As soon as she gets it, she puts it right on. And we always want to thank Freddy Santori, Am2.tv, and Gio.
Freddy. Without Freddy, what would we have here?
Just two guys talking.
We have a great show. And listen, by the way, happy Father's Day, John.
Happy Father's Day to everybody.
To all you guys,
Happy
too.
Father's Day to your dad. Happy Father's Day to you and me.
And mothers, single mothers that are divorced, happy Father's Day.
Happy Father's Day to your husbands. What I want to talk about today is probably, to me, the world's greatest golfer that ever lived is Tiger Woods.
Oh, yeah.
I don't care what anyone says. There is no one that I admire and respect more than this man. And it makes me feel, as a golfer, emotional not to see him playing. And I think I have the reason.
It's a real shame.
It is, because golf, no one watched golf until Tiger Woods came on, and no one was able to do what this man has done. And I could honestly say, Mr. Woods, or anyone that works with Mr. Woods, that if you give Dr. Pannozzo a call, I could almost guarantee.
Wait a minute.
Wait, what do you mean? You could fix him?
I could, but we can't guarantee.
Until he comes in, right?
Wait, we haven't seen him.
Okay,
Yeah.
let me
have a broken leg.
let me just go through some of the things that Tiger Woods has suffered from, Doc, and tell me, was a lot of this stuff necessary? He could only shoot an 80.
That was the last time out.
That was his last time out, and this man,
he was beaten by a 15-year-old.
He could close when he was feeling good. He could close his eyes and use one club and shoot under an 80, and that hurt me to see that.
But did you see when he swung and the club left his hand?
Yep.
It went into the bunker or something. I mean, the whole club went. I think he was on meds.
Yeah. What could cause that? Pain? Injuries?
Well, who knows? I mean, every time you have have an operation, remember you have a scar tissue following it. The scar tissue inhibits you from having a normal movement. So that the more surgeries you get, the less normal swing you get. So it's not surprising. I would like to have seen him before any of those surgeries. He probably would not have had any surgery because our program is not surgical.
Right.
Whatever that was done to him, they probably had good reason, perhaps, but we do these things without a surgery. It's still not too late. I mean, you can. No. The philosophy here is not surgery again. Forget it.
Right.
But to go back to the normal swing and forget all these people who teach you how to swing. They change your swing. Don't do it. You have to go to normal. What is normal for that person, and the way we do it is we film people with a full swing, and they tell me where their problems are, and I can analyze it, and then we fix them, and then do it again in front of the camera, so people can see how they are, and the whole thing would be going back to the normal range of motion, normal swing. That's what you have to do. You can't do anything else. There's nothing else to do.
Well, number one is for people who are listening to the show, they could always go to Pannozzo.tv and see what Dr. Pannozzo has done with people. Let me spell that name so everyone has it. It's PANNOZZO.tv. And you could actually see golfers that have...
you see Bob Tosky on there.
Well, you can see Bob Tosky. And give your other...
Pain management.
The pain management. Tell everyone it's pain management centers. The other one where I didn't write down. My mind just went blank.
Pain centers nationwide.
And that's all. And that shows everything about golf.
Yeah, right.
So you could go to any one of these sites and you could see.
We did the basic research on what makes the golf swing. That's my training, physiology, and you have to know a couple of things. You have to know. One, you have to know the anatomy. You can't have a golf swing without knowing the anatomy. What is being used to produce the golf swing? The PGA people do not have it. I wish they would. I'd love to teach them.
Mm-hmm.
Then the other thing is, how do you use the bone structure you have in the ligament? That's the physiology of motion. And if you have those things, you understand those things, you can get back to normal golf swing. Mm-hmm. And if you look at a 15-year-old, like you were mentioning,
this guy was amazing.
That's a normal swing. They're not old enough to have any injuries. Mm-hmm. So that's what you want to be, just like, and we can do that.
Before I go on, I promised a good friend of mine who I work out with, Dr. Stanley Gutierrez, happy Father's Day, and I hope the restaurant your wife has taken to you're going to enjoy. He's a great guy when I train with him, Dr. Stanley Gutierrez. Happy Father's Day, buddy. Now, the first operation that Tiger... Well, I'm a nice guy. What do you want? The first operation that Tiger Woods went for was in 1994 in December, his left knee to remove 2 benign tumors and scar tissue.
Well, that doesn't tell you anything.
Okay.
It's just ligaments.
Okay. So
those are nice words for the media.
Yeah.
Yeah.
But that could have been prevented.
Oh, well, you diagnose it and treat it. You don't operate it.
No. The next one he had for the same thing, I guess, was in 2002. The same left knee was, they had to remove fluid inside and outside the ACL and remove cysts. That was the second one.
Well, I don't want to comment on what these...
No, we're not having...
surgeon diagnosed. I don't want to talk about that. I can't.
Okay.
Unethically, I can't do it.
No, that's okay.
I don't know what they saw.
Right.
So to me, when you have fluid, you have a misuse of the joint. Mm-hmm. So no amount of surgery is going to fix that. Because why? Scar tissue again.
Right. Oh, because they said, okay, start, yeah. So in other words, let's just play devil's advocate. Tiger Woods would have come into you and said, Dr. Pannozzo, I'm having trouble with my knee. What would you have done? First of all, go through this. In case someone's listening, I want to see him back playing. I really do.
Well, we can't talk about him.
No. A regular golfer. A golfer comes into you and says, I have pain.
Anybody with a knee pain will figure out if it's actually a knee or if it's referred from somewhere else.
Okay.
Now, you can have a pain referred from the back and the hip and the knee. So you have to figure all that out. Mm-hmm. Then you have to figure out whether the knee is being bothered on the inside, which means fluid, or the outside, which is just a pain. Okay, if there's no fluid or anything on the inside, no heat, synovial reaction is not there, so forget about the inside. It's all on the outside. This is so simple, you can't even believe it. This is how you have to approach it. Now, if the knee is cool, but it has a restricted range of motion, then you treat that ligament structure and get the range back, and that's how you fix it. You don't operate those.
No.
So on your foot, Doc, if the foot is cold and there's pressure, like inflammation, like it's swollen, but it's cold, what does that tell you?
It's just a ligament. So
that's what it is.
It's not the joint. It's just a ligament somewhere. You have to figure it out.
Gotcha.
You have to know the anatomy, and that's what I know the best.
That's what you studied, yeah?
Yeah, I know the anatomy.
And understand one thing, he's a real doctor, guys. Graduate of that famous Ohio State University.
Oh, the Buckeyes.
Go. Woody Hayes. No, Woody Hayes.
Showing your age.
I know. Well, I'm an old guy. What do you want? 1-800-889-0267. For a lot of you golfers that want to go out and play golf, I mean, this is the greatest place in the world to live if you're a golfer.
Absolutely.
365 days a year to play golf. Why should you be in pain? I met a golfer that Dr. Pannozzo took care of, who waited a long time. until he finally got up the nerve, because we had kept on talking about golfers. He came in to see Dr. Pannozzo. It's so sad, Doc. You fix him in one shot. I
Yeah.
mean,
Well, what does that do for my reputation?
I mean, come on, one shot.
You're forgotten.
He
The
forgets all,
whisperer.
he forgets all the people he takes care of because they're in and out.
Yeah, we
Can't even eat lunch, you and I.
I know. We do the best we can on everybody. I mean, you don't get shortchanged at all. I mean, if you have to wait, you wait. That's all. It's worth it.
Well, for all of you up there in Atlanta, you could also
That's
you
right.
could also see Dr. Pannozzo on what station, Freddie?
I wanted to thank Atlanta for taking Dr. Pannozzo's show in.
Perfect.
8:60 a.m. Up in Atlanta, and that's Leander Cooper is the general manager up there, and they've already sent some questions, Doc. So when we do the question deal, we'll pump in some chat questions.
Well, let's
Yeah.
start. Let's start now, since we have questions. If anyone wants to call Dr. Pannozzo directly, it's 1-561-381-5800, and you can call him anytime you want, because I'm driving today, so and he can sit there and take all your calls. Go ahead, Freddie.
Well, you got to remember, Atlanta's watching you for the first time. They've heard you now for a
Right.
couple of weeks. So some of the questions that they may be asking may be repetitive, but
That's
we'll
okay.
just go through it. Like Janet from Atlanta on the chat box says, people from my church want to know if we can put together a package of about 50 people to come down and see you. I have never heard of anything so amazing. Where have you been hiding?
Love it. Love it.
Just import me up there. I mean, that'd be the better way to do it.
Well, I'll come up with you, and I can visit my daughter. It would be great. We can both come up,
That'll work.
right? Nothing wrong with that.
Ain't nothing wrong with that. Grizel writes in, I've heard your show here in Atlanta a few times and I cannot get over the knowledge that you can cure migraines from the top of the spine. Are most pains in the head associated with spine injury? That's
Yes.
a question.
All of them.
All of them.
Wow.
There you have
Well,
it.
it's amazing. I just want to interrupt, and I've watched, and to me, was I skeptical? Yeah, of course. Everyone's skeptical. All these neurologists and these medications that are coming out, and the pen that you shoot in your leg to get rid of your migraines, never worked. And I've watched and seen, and you can go to Pannozzo.tv if anyone doubts me. All these people that 1 2 shots and they don't come back. They're cured.
That's right, because you have to know where to treat. And we figured that out. We did the basic research on that. There's no one that did the basic research. I did it.
Why do neurologists can't figure this out?
Well, their training is drugs. But they're treating a symptom. A headache is a symptom, not a diagnosis. See, when you get a headache, it's coming from somewhere.
Right.
It's a referred pain. It's just like pain in the back causing leg pain. It's a referred pain. And you have to understand the concept. And so I worked on it, and my son worked on it in Arizona, and we come up with a whole plan for it, and it is 100% effective. Try it. People try these things.
What do you got to lose, right?
Yeah,
You got nothing to lose.
Yeah,
It's
yes,
a
you do.
one-day treatment.
You do have something to
Yeah,
lose.
headache.
Pain.
That's good. That's good, Les.
But think about it. I mean, think about it. Why should you suffer? I mean, people. What I say to everyone: just come in. That's all you have to do is come on in, meet with Dr. Pannozzo.
The other thing is the basic concept you have to understand is all pain is from injury.
Mm-hmm.
You can't have a pain without injury. How would you have a pain? I mean, I don't have any pain, We have a basic construction of our body. And if you understand how that works, then you know that you have to have an injury before you have a pain.
Mm-hmm.
And then you have inflammation, then you have scar tissue. So that's the way it goes, 1, 2, 3. And you could treat it at any stage.
So it's an injury. So I understand. A migraine headache comes from an injury, then.
Yes,
Wow. Okay.
all injuries.
Yeah, because you're not born with migraines. And
You're not born with any pain whatsoever.
And it's not inherited.
No.
Just like scoliosis, you're not born with scoliosis.
And you could lift a bag and injure yourself.
Yes.
Which is what happens to me a lot.
Mm-hmm.
You lift, you pull. I thought I had a kidney problem because I had a pain in my back, and now it's gone. But I must have pulled a bag wrong.
Well, you had a scoliosis, though.
Do I?
Yeah. That's basically what you have.
I hope not.
That's what we fixed.
Don't start,
we
Doc.
fixed it. No, we fixed it.
Well, we know where to go.
Well, yes, we do. But you know something?
You don't want scoliosis.
I don't want it. You know, isn't Atlanta the headquarters of the Scoliosis Federation or something?
I have no
Hospital
idea.
there?
I don't either.
They're
A lady-
wrong, whatever it is.
A lady from Atlanta, Joyce, writes in, when I heard your show on 8:60 a.m., I knew that you could not be from Atlanta. I visited many doctors here for my scoliosis, and they said they would never treat it your way. I've been told that this disease is treated many
Wait a
different
minute.
ways.
What does that mean? My way.
I'm going to tell you. I've been told that this disease is treated many different ways because not all scoliosis is the same. Is that true?
No,
Well,
it's all the
obviously,
same.
Doc, they
All-
must be watching you if they don't treat it your way. That's what I got from it.
That's what I got from
I'd
it.
like to know who's
So would
talking
I.
about my way. Nobody asked me.
Right.
I mean,
It's
So-
funny. They won't ask, but they'll
yeah,
criticize.
they'll criticize. Right. Yeah.
Well,
That's the other point I wanted to make. Make sure your physicians don't give you bad advice based on no knowledge, because they can say that, just like, oh, we don't treat it that way.
That's right.
What way? I mean, this is the only way you can treat it. You find a scar tissue, you treat it, and it straightens up. That's what happens. There is no other way to do it. Chiropractic doesn't do it. You can't get to it. You can't get to the scar tissue.
because there's manipulation. Yeah.
Manipulation, you can't get to it. You'd have to wreck the body to get to it. That's why we use shots, because you put the medication where you want it. It's very sophisticated work. This is not stuff you're going to find out next door, just walking in somewhere. No. This is very sophisticated work, and if you don't take advantage of it, you're missing yourself. It's not good for you, because these do not get better. This is scar tissue
worse.
in the spine.
Well, we have someone who listened to a show, since you're speaking about scoliosis, and her mother called you, and this is a 21-year-old girl or
24.
And tell me about it. I wanted the audience to hear. This is a mother
This is
who
a great
saw your
story.
show. It's a
Yeah.
great show because it's amazing. We're going to hopefully, this Monday, take some pictures to put on our site. What happened?
Well, she came in for an exam, and then we found out she had to find out whether her insurance would cover it. It did, and by codes, everything's done by code, and they will pay for all that. And so the mother sent her in, and they're very happy. She has already gained on the second treatment. She already gained 3/4 of an inch.
Wow.
And she's
High,
24 now?
Tall, 24.
24 years
Now,
old.
can
That's
you
great.
imagine? Was it really, really bad, severe?
Yes, it wasn't getting any better
Did she go to the beach or anything like that?
No, she would
Pools?
not,
She
because
won't.
of
She
the-
didn't go out.
because of the curvature.
Well, this is the psychological benefit of what you do. It's just even that is just work.
That's very true. The
obviously.
psychological benefit,
I mean,
the
24-year-old.
confidence. Yeah.
You know what that does to the brain?
The parent should be guiding the child to the right treatment, and this is the right treatment. I mean, there's nothing I can do more than tell you this is the right treatment. I am the physician.
Well, they could go to your website and
There's
see.
nothing else out there.
No.
Physical therapy doesn't do it. It can't do it. They don't even know where the scar is. There's no exercises for it. Chiropractic, same thing. You can't just be doing this and get to it. This is all the way inside the body, in the middle. And there's no way for them to know where it is.
Right.
We do special films. We happen to know more than we're even talking about here.
Right.
But the results are there, and it's progressive. It's every day you get better and better and better. And what more can you ask for? And there's no downside to it. No surgery, no
No medication,
life-threatening
nothing.
procedures, nothing like that.
Doc, Paul from Atlanta just wrote in. He wants to know, have you ever met a child or a person that has scoliosis, such severe case that you could not help them?
No. For the most severe cases, it takes longer. The less severe, it takes faster.
There you have it.
But that's all it is. It's all scar tissue, and you have to chase the scar. Once you treat it, it comes out, the scar comes out, the bones come apart, and you become straight. That's the way it works.
But can you compare that answer to somebody who's about to have rods put in
Oh,
and change their life?
that's a sin.
For the rest of their life,
Yeah.
it changes them.
Yeah.
No, that should be outlawed. It really,
Yeah.
it's now that we know how to do it, especially the surgery should not be done. I mean, that is cruelty. I mean, why treat a child?
Especially
like
to a
that?
young child that
it's
loses the
just
mobility to do the things that,
terrible.
like, I'm assuming they can't play tennis or.
It makes me sick to my stomach.
Yeah, no, I
when
know.
Think about it.
It should.
Doc, Michelle from Miami writes in, why isn't this treatment being taught in medical school?
Well, because the research was just done. I haven't published it yet. And it's very hard to publish something like this. This is earth-shattering stuff here.
Put a lot of people out of business.
Who's going to believe it? You know, you have these orthopedic surgeons, big names all over, and they say, oh, the rods are the way you have to go. And there's little old me in Delray Beach saying, no, this is not the way to go. This is the way to go. And who's going to say, well, the guy doesn't know what he's talking about. But actually, I do.
Well, what's funny about that, we have the lady from England who was told the same thing at one of the most prestigious hospitals in England. And
That's right.
if you go to Pannozzo.tv, Pannozzo.tv, I want you to look at her and look at the x-rays and look at the before and afters. This is not something that we could publish if it wasn't true.
In 4 weeks, we took more than half of that scoliosis
Right.
away. Permanently. It's not coming
it's
back.
never coming back. That's the beauty of it. It's like migraines. Once you get rid of the migraine, it never comes
But that's
back.
like somebody just wrote in that we should go speak to the Congress people and have Dr. Pannozzo, a friend of the medical board up in Washington, so that he can witness and say, listen, I got something here that will
Oh,
work.
man, that would be so great if we could do that. But, this politics, I don't want to say it on the air because I don't want to get sued.
How
But
you have to do it is you have to get a well-known department in the medical school
Mm-hmm.
to follow the research on this, and then put their name on it. It works, and
Yeah.
then you can publish it, and then it goes all over. But physicians are very, very critical of anything new. They really have to be convinced. And but I'm saying, look into something that works.
Mm-hmm.
And if it works, like for instance, the children's hospitals here, around
Yes.
here, they never asked me about it. They're
which,
treating scoliosis every day, autism.
They put commercials on it for the
Yeah.
rods, for
and
God's
nobody
sake.
ever asked, what do you have to offer? Why don't you come and talk to us so we can do the right thing for these
They
kids?
have a whole wing to a hospital.
Why don't they want to do the right thing for the kids?
that's
don't
what
know.
I don't understand.
I don't
No,
understand.
I agree 100%. Why? I mean, why don't the...
Well, it's ingrained in how they do it. Well, this is what we do. Well, why do you do it like that?
Right.
I mean,
What about the
you should-
pediatric doctors? They should be clapping their hands and going crazy that there's someone that could actually cure this disease. It is a disease.
I wrote to 11 of them last year. Nobody even picked up the phone to say, what's new? What do you have to offer? Nothing.
Well, let's talk further. What about let's talk further?
Well, come on down and show me what it is you do.
But the letter to them said, bring your patient in with you, and I'll show you everything, and you can see the improvement right in front of your eyes. Did I get somebody to say anything? No, they think it must be quackery. No, it's not. It's good science.
So, folks,
Now, what is the science for education of people? Reproducibility and predictability.
Mm-hmm.
So if you can predict something and you can reproduce that as much as you want, that is a science. That's why you can go to the moon, because the moon is always there and you can get to it.
right?
Reproducibility, see? Predictability.
So you just said something. Now, if you're going to the moon and going to see you, I mean, it sounds crazy, but no one in the world ever thought you could go to the moon. Did anyone ever think that when we watched Flash Gordon, that you could actually go to the moon?
Yeah, well, I got questions about that anyway. But the bottom line here is that you are more consistent than going to the moon, which I don't believe we went anyway. But you are more consistent. You are more consistent. Consistency is the price of
And
success.
it's not just me saying that. I mean, you saw it, and
Oh, God, yes.
Les
I
saw
see
it,
it.
and the patients see it.
And every
mean,
time
what
I
more
go
do
to
you
your
want?
office, I see it.
Yeah.
It's not a story. It's a consistent, consistent.
Consistent. Yeah, everything we talk
what you
about
do.
here is true.
If
If
we
you
can
say,
back
"Do you
everything
really
up.
do that?" Yes, we really do
Yeah.
that. I mean, I'm not going to ruin my reputation by saying something that's not true.
And we're not going to ruin our reputation over years.
Unless it's the same
So
thing.
everything we say is documented. You could go to any website you want, and they're going to say the same thing I'm saying on the air, because the beauty of the internet is you could actually look at it. You could go there and see. I mean, I looked at those pictures of these kids with scoliosis, those rods, and I'm going to tell you something. It's emotional to know that a
it's
child has to
sickening.
go through that the
Sickening.
rest of their
But
life.
The patient themselves could see it on the fluoroscope, before and after. You see it. We show it to you.
I
I
mean-
take pictures of it. I mean, it's just true. You can't do anything better than that. I'm not
No.
kidding you. People, believe me.
And if everyone listens to our show, I just want to preface one thing. No one sponsors our show.
No.
We don't have sponsors coming on. Our show
We don't sell anything.
is being paid to help people to understand that there is an alternative. Does Dr. Pannozzo charge money? Of course. But guess what? Nowhere near the $65,000 and $90,000 to get rods and be ruined the rest of your life. To me, I would say, come see a doctor.
The insurance company should be grabbing onto this.
You can save a lot of money, the insurance companies.
Save us tons of money.
Well, the funny thing is that because we do other shows, we host, not host, but we produce other shows, and one of the hosts from another show says to me, "Boy, I heard Dr. Pannozzo, and you were really, really kissing his booty about the show." And I said,
So true.
I'm a patient. Man, help me. And what he's done for me and what I've seen is short of remarkable. So it's telling the truth. Doc, if it didn't work, I wouldn't be here.
I wouldn't be here
I'll
either.
be very honest.
Of course you wouldn't. That's why we have to prove it to you before you come
Yes,
on board.
that's right.
And we do
Exactly.
that to everybody.
We don't let anybody
Like
endorse
Leah.
our product. Lisa, yeah.
Leah, we had to
But
prove it to her.
you cured her.
Yeah.
Well, we cured her. Well, she'd have to wear a boot, number one, and
Do you
number
know
two is
that we saw her the one time, she's never been back
Never
for
come back.
treatment? No.
she has no more pain. I called her up and say, "Well, you have any pain?" She said, "No." I said, "What happens if you have pain?" She says, "Les, you know where I'm going." And
Come and see me anyway, Leah.
Well, Jimmy the board up says he's going to come see you because he has a different pain.
Yeah.
But he tells everybody. He has his own fan club now. And he tells everybody. He says, "Listen, if he didn't help me, I would tell you the guy didn't help me."
Yeah, that's why we insist on the truth. You
yeah,
can't-
if he doesn't help, if someone wants to call up that went to Dr. Pannozzo and he didn't cure you, call us up. We'll answer the question. What a lot of people don't understand is if you come in with a back problem and he cures it, don't tell your friends, "Well, my leg still hurts." Well, of course your leg hurts because you look at your leg, look at your back. And people are like that.
But almost everybody, like as you've noticed, is improving right along. They're just reluctant to come on the radio and talk about it.
That's right.
I mean,
I guess they don't want
okay.
people to know.
That's okay. We got people writing in now. We'll take it.
We'll take the write-ins.
We're taking these patients with scoliosis right to normal, yet they won't call in and say, "Yeah, it does work," But so, what are you going to do?
Well, do you ever see how people who have scoliosis, the way they dress,
Yeah.
they put the big clothes on?
Yeah, because no one like those moo-moos.
the
Am I right?
muumuus and
Colleen, is that true, a moo-moo?
well, she doesn't wear a muumuu.
No, but I mean the old ladies with the scoliosis. They
No,
wear
I'm not
those.
talking about even the
But
older. I'm talking about young kids. though.
there is no downside to what I do. Absolutely none. You
Right.
cannot get hurt. You cannot get worse. You can only improve. The more you put into it, the better you're going to get. I always tell people the musculoskeletal business is the pain business. You can get as good as you want to get.
Oh, yeah?
You want to be 100%, it takes 100% effort. If you want to get 90%, then you can get 90% of improvement. It depends on what you put into it.
That's right.
So if you want to talk to Dr. Pannozzo directly, you can call him at 561-381-5800, which I don't like to give that number out anymore because you and I haven't been able to sit down to have lunch yet for longer than 6 minutes.
Well, we're in Delray Beach, so it's kind of in the middle of everything.
Hey, look, I go to my gastroenterologist in Miami. If you want the best service, here's the way I feel about medicine. You go to the doctor that knows what he's doing.
Well, listen, if you come to my office, right around the corner is Francesca's, a new Italian.
Oh, yeah.
You can go there, too.
Well, all we know is that's what we eat, and it's like being in Little Italy.
Francesca's, is that you?
Yeah. Him and I went in there. He was telling me all about it, so I went
Where
in
is
there.
it?
It's right there where that other restaurant is that we always go to.
Oh,
Poppy's.
Poppy's?
Yeah.
Oh, it's in there?
They're not paying. We don't want. No, we don't. This is just an endorsement from us. Just like you're in Italy. It's an old Italian man.
I got to try it.
And it's one day Tuesday or Thursday, him and I go out to lunch. Okay. So when he leaves to run after a patient, wish you could take me home and let me finish my lunch.
And so he gets phone calls where you're out to lunch. He
Yeah.
gets phone calls here.
Yeah.
I just put the blueberry pancake in my mouth when one guy kept on calling him every 5 minutes. He said, "Well, you said 5 minutes. 5 minutes are up." We walk in, the office is packed. And what I'm trying to tell people, the guy's got to eat. I mean,
No, you listen. Bottom line, he don't got to eat.
No, he doesn't
Come on
care.
in, stand in line, bring a sandwich, do
That's
something.
true.
to him, the
And
patient is the most
because
important.
living in pain, unless I don't got to tell you, because you couldn't walk straight
Oh,
for 2
God.
weeks. Living in
Whoa.
pain is no fun.
Let me tell you, that was the most pain I've ever been in. With a groin
hurts.
pain is
Groin pains
really
hurt.
Do you have
painful.
another question?
Yeah, come on, let's get some more questions.
Do you
Because
got-
I have a whole
See if
bunch
you
here.
got- Let me check the box.
Okay, well, you're doing that. Let me go here.
I don't see any calls on there.
Well,
Give up the number.
okay, the number is 800-889-0267. That's 1-800-889-0267. And Colleen is doing her nails now because no one's calling her. We want to make sure that Colleen has something to do today. So call Colleen at 800-889-0267, and she'll put you right through to Dr. Pannozzo.
I think she's swearing at you.
No, not Colleen. Colleen, you wouldn't do that to me, would you? No, Colleen's too sweet.
We can't hear it. That's why I said that.
Okay, here are some questions that we never took because we got so busy. Mick from SurveyMonkey writes, if you have a shoulder injury, can there be different types of shoulder injuries? In other words, can I have a different type of shoulder injury from, say, a baseball player? I understand your treatment is different for each person, but you use the same medication for each. Why is that?
Well, shoulder is made a certain way and to do a certain thing, so
Right.
you can't change that. That's
Correct.
normal for a human. So the injuries take place on a matrix that you already have, that everybody has. So you examine it and find out which parts of it are painful. You treat those parts. You don't treat the whole thing. You treat parts of it,
Right.
which is what you have to do. And to get the normal range of motion back is not that hard. It takes 2 or 3 days, but that's it.
That's amazing. Any more? You get any more calls while I'm doing this?
I'll
'Cause
keep going.
I'll
No, I
keep
got
going.
one,
Okay. Larry from It's Time to Play Golf.com says, just joined as a fan of the show and wanted to learn more about how I can increase my drive from the tee. My pain is in my lower back and prevents me from swinging through. A friend of mine said you can work on my lower back and I can play golf that very same day. I know that you haven't seen me yet, but is lower back pain common among golfers?
Yes.
That's interesting.
Yeah. Well, let me just, while we're doing that,
Not only
yes.
that, but we know which parts of the lower back are affected,
Yes.
and we treat those directly. Now, there is no resting because I want the motion, and that's how you get the ball to go from here to there, by swinging forcefully. So yeah, we'll send you right out to the golf course. You can't get hurt. You can only improve.
Well,
That's a
Go
good
ahead,
point.
go ahead.
I just wanted to say, if you're on pain meds right now, or you're taking painkillers, and you want to go see Dr. Pannozzo, you got to get off the meds.
Yeah,
got to get off the
don't
painkillers.
take anything.
Yeah.
Right.
Because you want to come in with the pain so he can locate it and
Exactly.
fix it. So
Right.
That's a good
if you're-
point, Freddie.
If you're on pain meds, you're not going to be helping the situation.
No, we do a special film and special analysis. I mean, this is not by accident. I
No.
mean, we really know what to do for it. So I tried. I mean, we've had people that couldn't play for 2 weeks and then the next day played 18 holes. You say, how is that possible? Well, hey,
Well, the guy that hadn't
you
played
have to
for
know
2
what
years
you have to
came
know
in.
what you're doing. Yeah.
2 years he hasn't played golf. He heard it on came in. I don't remember. I'd be lying if I said I don't remember what you did. But all I know is he said to me as he was going there, because you have golf clubs, he was swinging the golf. He said, wow. He was like 85% base. I said, what are you going to do now? He said, I'm going to wait and see what happens. I'm playing golf tomorrow. He came back, I think it was a Thursday when you and I were going, and he said, let me just say, I'm not here for anything. Just say thank you. And if you're a golfer, well, I shouldn't call myself a golfer. If you play golf and you can't
Well,
play.
you're a golfer.
Yeah, and I'm going to get fixed with my golf. The next thing right now, all I can say is we're all patients here. Colleen, you have any problems? Oh, Colleen's too young. She doesn't
You know
have any
what? I'm
problems.
the only one that can't get my golf fixed because I have to go to Arizona where my son is. There's
Well,
no
tell
one around
Paul to
here.
come down here.
There's no one around here that understands it, and I would not subject myself to anybody else.
But
So
but you take the shots. Paul takes the shots. I've taken them. Freddie's taken them. Jimmy Leah. Everyone's
there's
taken
nothing
them.
wrong with that. It's the best method to get the medication where you want it.
And we can
Forget about going through the mouth and being off for 6 weeks. Forget about that. We want you on the golf course the next day.
And you could
And
guarantee
we do
up
that.
to 40 yards. I'm not going to say 40 yards, up to 40
Up
yards.
to.
So if you're a golfer, and Freddie, who's just starting golf, if you could get 10 yards extra on a golf swing, my God, on a drive.
Well, I always tell people when you come in here that we treat you, don't tell your people that you're playing against that you've been here. Tell them after you take their money.
Well, we had another guy that came in who was a friend of my brother-in-law's who had tried everything. I mean, he has been, and I don't want to mention his name. He's a fairly well-to-do guy, plays golf 3 or 4 times a week, and he came in to see Dr. Pannozzo, skeptical as anybody. Took the x-rays, did the stuff. I don't know if you could see him, but he started moving his back and said, ooh, I don't have any pain here. Okay, let's see what happens tomorrow. He hasn't been back. And my brother-in-law says, we had to change his handicap because he couldn't hit. The drive is the most important thing in a golf. If you can get that drive to go straight.
Right. The drive has everything in it.
Yeah, that's it.
Now, after
Every part of your body, yeah.
After that, it's more the art of golf because you don't
correct.
use a full swing.
Right. Usually.
No. Unless you're far away from the cup. But usually it's which club do you use and where's the tree? You want to go over or under the tree? That kind of stuff. That's the art of golf. And the PGA guys should understand that, but they don't. They're still working with the wrist. It's just.
I think what they try to do is they try to change the swing, which is the worst thing in the world.
You never change the swing.
No, it's so hard to get back. We're going to take a little break now, folks. We will be back again. 800-889-0267.
By the way, if any of these PGA guys want to argue with me, just
please come on. You can call us up.
Call in or sit right here.
In fact, we'll
invite them on the show.
Colleen, before I take a break,
they'll never win because they don't know the anatomy.
Any PGA guy, any orthopedic surgeon, or any chiropractor, we would like to have you come on the show. There'll be no arguing, fighting, and the two of you just talk about what we can do.
There's no talking to the chiropractor because they just don't think in the terms that you need, and the surgeon doesn't either.
But what I want to give people the opportunity to be able to say how they feel.
Yeah, do it to me, not about me.
Right,
No,
just about, not personally. Okay, Colleen, she's yelling at me. We will be back in a minute and a half. Thank you very much. We'll be right back.
Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon.
You're listening to Dr. Pannozzo's Sports and Medicine Hour with Dr. Anthony Pannozzo. If you have constant pain and want to talk about how to get rid of it without surgery or medication, or simply want a second opinion, call Dr. Pannozzo now at 1-800-889-0267 to get your pain issues resolved. Now, more of Dr. Pannozzo's Sports and Medicine Hour.
You know what's funny, Freddie? I'll tell you something that's very funny. In this new world we have, people don't want to call on the phone anymore. They just write. I must have 200 questions here.
I have one that just came in.
Let's take it. Let's stump them.
Smitty is a pastor in Atlanta, just wrote, isn't painkillers into the area work the same way that Dr. Pannozzo's treatment?
Well, there's two problems with that. One is we don't know what the painkiller is. Painkiller alone is not going to do it. Secondly, where do you put it? That's the diagnosis, and that's what we excel in, the diagnosis. How can you remove a pain the same day you walked in with it unless you know where to go with it? I mean, the body's big, right?
Well, explain to him how you can have a pain in your foot, but it's being generated by something in your hip.
Well, the diagnosis is extremely important. Without that, you can't get the result. There's no way to do it. That's why there's failures in treatment. The diagnosis is wrong, and I see that every day. I take a history. Every time you come in my office, I find out what people are doing, and I say, well, that'll never do it. So that's why you're here. You're in my office because everything was a failure. But you don't leave my office with the same pain you walked in with. I won't permit that.
Well, he yelled at me. I said, Doc, I have a pain. He says, where? What'd you do? I said, I don't know. I did this, that, and the other thing. He knew I said, I went to Pittsburgh. He said, and you pulled out the trunk? And I said, yeah, and I started getting pain in my groin. He said, okay. He found the pain with his finger.
Well, that's a diagnosis.
Did I jump?
That is primary. So if you don't do well in a couple of days, the diagnosis is faulty. Even in my office, those are the standards I've set for myself.
So if the pain returns, it was faulty.
Well, if it doesn't leave, it was faulty. So the pain has to be treatable if you have a proper diagnosis.
Mm-hmm.
Right.
Well, you told me there were 5 areas in the groin, and we attacked 2, and those 2 were done months ago.
Well, there's caveats and everything, but essentially, you will lose the pain you walked in with. Otherwise, you can't leave.
Okay, let's go. I have another question. I wish all you. I'm very happy that everyone sends in questions, but I like you to call once in a while so we feel that we're really talking to somebody. But okay, so Amy from Google Plus writes, "I'm a stay-at-home mom and have been for 8 years raising my children. I can't work due to the pain in my hip. My husband told me to listen to the show, and I watched the tapes on your website. Thank you so much for doing that. My concern is that I never had hip problems till I gave birth to my 2 children and was told that's normal."
That's not true.
Okay.
We don't know what she's got.
No. So, Amy, if I were you and you're really that concerned and you really have a lot of pain, you could call Dr. Pannozzo at 561.
Yeah, come in for a diagnosis.
Yeah, just come in at 16244 Military Trail, right across the street from Walmart, and then you'll be able to go shopping afterwards. Of course, you'll be able to walk without the cart.
Right.
Okay, so
I got one. Can you speak on the recurrence rate of injury after your treatments?
There's no recurrence.
In other words, does the
Wow.
pain return after treatment?
No.
Sometime.
No.
Absolutely not.
So, in other words, if you come in with a pain,
Now, here's what happens, though. You take care of the pain somebody walks in with, but that may not be all of it. It may be the primary that we notice first. So, if another pain occurs, it's not the same pain. It'll be around it, but not exactly
In the same region, but not same place.
Same region, so you have to just chase it around a little bit. But essentially, what we're saying is true. That the main pain you walk in with, you will lose that day.
and we've seen it. You've seen it.
I live it.
I've lived it, I should say.
Hey, I live it myself. You know, I'm just like everybody else. I get hurt, and I get treated the same way. I mean, so we know what these things do. If you ever call me and say the treatments didn't work, I'm going to say you're wrong.
Mm-hmm.
You come in for an exam. If you don't show up, then you're lying.
Right.
See? That's the way it works.
And you will not let a patient leave that office. I've seen it.
We don't.
They sit right there and they start talking to the people as they're going out. Oh my God, Colleen, we're going to bring you down there one day and you're going to see what he does.
You'll be the witness, Colin.
You're going to be the witness. But you won't get on the radio. She's shy.
Doc, I got another one. Are there any side effects to the medicine you use?
Only in diabetics.
Which is?
It raises the blood sugar, but
Well, you're
it goes,
diabetic.
It goes right down.
It didn't do too much to mine.
It goes right down in 12 hours. You have to be a real severe.
You're
Severe
severe diabetic.
diabetics know how to handle their sugar. I mean, they know how much insulin to take. They test themselves. There's really no downside to this.
Okay, I think someone's calling in, so I'll see if I
Just
get
be
a.
patient.
Yeah.
You'll be all right.
I know. I see. Colleen's
Take it
trying-
easy.
is typing
Take it
for me.
easy.
Okay.
And if anybody out there knows Tiger Woods, a friend of Tiger Woods, seriously speaking, would like to talk to him. Not that we're going to do anything, but we
No.
just like to talk to him.
Just talk to him and maybe let's put it to maybe because you don't know how much scar tissue is there from all the other surgeries. We can't get, but just come in and talk to you. I mean, it's well.
We'll go to him.
Yeah.
I'll drive the doctor up. We'll get a limo and
I'll
everything.
bring my little club and have them swim.
How far is Ponte Verde far from here? That's
For Tiger Woods, I'll take a plane. Makes no difference.
we will. So Mr. Woods, or we'll rent a plane to see
Jupiter.
him. Yeah. Is it in Jupiter?
It's in Jupiter.
Oh, we'll hire a limo.
Yeah.
Why not?
We'll go see the good man.
We have no problem seeing him, and gee, just to get him. To me, I don't watch golf unless he's playing. Okay, we got the other Dr. Pannozzo online, Paul. Let me see. Hello, Paul.
Good morning, you guys.
How you doing?
How you doing, Paul?
Good morning, Paul.
We've been talking about.
Happy Father's Day to all the fathers there.
Oh, thank you. Happy
Happy
Father's Day
Father's
to
Day.
you. Got anything planned?
What's that?
Got anything planned for today?
Oh, we're trying to do a hike, but it's going to be
Too hot.
probably about 112.
Yeah.
Oh,
I
good.
heard about that. You guys got heat going out there.
Whoa. We were
Yeah,
talking
it's-
about with your dad about Tiger Woods and trying to offer his people the opportunity to meet your dad and see what he could do about helping him. Because, golf isn't the same unless you see him on
I
those
don't
2
know.
days.
He's got so much wrong with him. I might have to import Paul.
Why not?
Double team him.
I think that would be great. Of course.
Yeah, from all the things that that poor guy's had done, just sounds awful.
I happen to have his medical stuff in front of me. We went over it before you called about all the surgeries he had in that left knee of his.
See, no one that comes to us actually gets treated this way. I mean, they're fixed real quick. I mean, I just can't imagine what's going on over there. I just.
You know the sad thing? All the money he's leaving on the table.
Oh.
This guy used to be the #1 paid athlete in the world.
Wow.
Not no more.
I still think he's one of the greatest athletes I've ever seen. I feel bad.
Used to be.
And you know what? No one watches golf unless he's there, really. I mean, it's not exciting. I mean, the shots he used to make and how he used to play the game was absolutely amazing.
He can go to the pro shop and sell signed balls because he ain't playing no more.
No.
Yeah, I don't know if the topic came up, but the idea of that they're doing the old man's doing down there, Anthony.
The old man.
The idea of the
What
medical
old man?
golf.
Who are you talking about?
Talking about you.
Yeah, what's the best way to address them on the radio? But
Dad?
But the concept of that medical golf academy, you hear Tiger Woods, his coach tried to change his swing, right?
Right.
Well, could that be because of now he has a condition or a handicap that limits his swing? So what my dad's doing there, which is a pretty neat thing, is trying to work with the coach to make the swing, the way you naturally, to put in your natural rhythm, not to change the swing, but to fix it from a medical basis. So that's really probably the best way to go.
Mm-hmm.
I've been trying to do that here, but can't find a professional golfer to work with.
Really, in Arizona?
Well, they're trained a certain way, and they just don't change.
Yeah.
I mean, you can't change them.
I know.
Because they don't have the background. They don't have the knowledge. They don't have the education.
So all you golfers now, you have an opportunity to talk to the two Pannozzos. So if you want to give a call, and both Paul and the two Dr. P's are right here, 1-800-889-0267. And so if you're having a problem with your golf swing, talk to them.
Yeah.
They can't diagnose you on the phone, but you could see Paul in Arizona. Give your number out, please, Paul.
623-776-8686. Yeah, I was going to say something.
Go ahead.
That if you're a professional, it means you've been doing something for a long time. Perhaps 10,000 hours or so. It's said it's the amount of time you need to spend to really be an expert at something. All the swings you take, the golf swings in 10,000 hours, or the tennis swings, or whatever sport you're playing, that motion pattern, that coordinated firing muscles, that is ingrained in your brain. You're not just going to find some coach and he's going to say, "Oh, change your swing," one day, and it's just going to work.
Mm-hmm.
So that coordinated pattern of bringing the club back, bringing the baseball bat back, or the tennis racket, or whatever sport you're playing, basketball, that coordinated pattern of actions is ingrained in the brain, and it is
Muscle
not.
memory.
You are not going to be able to just change that. There's a physiologic construct there that just does not change with coaching. That is. It's already ingrained. I think trying to find a new coach to change everything up is probably one of the things for an athlete. They need to, be able to work with themselves medically to make for them to continue with what they're doing. It'd be very tough.
Yeah, the PGA, if you ever go up there, PGA Boulevard, wherever they are up there, north, they have a lot of computerized approaches. And they really think that they know what they're doing with that. But you see, a computer only reports what it sees. It doesn't tell you why you're seeing it. Okay? You still need the physician who understands the swing, the physiology of the swing, in order to find out what's wrong with it. So you might get this, and they report that to you, and then try to work around it, but it's not going to help because it's only reporting that you're getting from the computerized system.
Okay, someone just called it. I'm not giving it. I'm saying the number too fast. 1-800-889-0267. How did I do?
Slow.
Slower than that? Okay. Oh, his number. Oh, someone wants your number at the office. Thank you, Colleen. It's 561-381-5800.
Right.
Let me do that again. It's 561-381-5800.
Right.
Thank you, my dear. What would I do without her?
Well, Paul's on the air. Paul, I got to come and see you.
He's got
I got a
pain.
problem of my own. And but they're
What's wrong with you?
I have a little pain. I move equipment around all day, and I've hurt myself.
You pull something. Doc, it's really interesting what your son just said, because as a baseball hitting coach, I met a gentleman who put together a program for eye-to-hand coordination.
Mm-hmm.
The major leagues are using it now. The Twins, Minnesota Twins, were the
Wow.
first team to use it. And he sat down and he showed it to me. And I said to him, if I have an injury in my shoulder or my hip or my front arm pulled through, it doesn't matter how my hands and my eyes coordinate, because I can't finish.
Right.
I can't follow through.
That's exactly right. Your thinking is proper.
You should have seen his face, Doc.
Yeah.
He's been selling this program to the major leagues.
Yeah.
They're going about this all wrong.
Right.
You can have great
Very
hand
smart.
to eye,
Very smart.
but if you develop a hitch in your swing to compensate for a
No,
bad shoulder,
it's all ligaments. You're absolutely right.
and your son's about muscle memory, do you
Right,
know
that's
good
it, right.
technique, muscle memory? Bad technique also has muscle memory.
Well,
And it's
that's what they
hard to
try to
break.
ingrain, but the body will.
Well, we got Jane on the call. We have Jane that wants to talk to Dr. Pannozzo. Thanks, Colleen.
Who?
Jane. Hi, Jane. You got both Dr. Pannozzos on.
Okay, can you hear me?
Yes, we can.
Okay, I have a question about my grandson. He's 12, and he gets a pain in his neck, and he goes to see the chiropractor, and the chiropractor says he's always out of whack, and he puts him back in, or adjusts them again. But I'm wondering, would Dr. Pannozzo be able to do anything, or maybe look into that further?
Yeah, we would fix that in one day.
Now, would that be a shot?
It could be. It depends on the maturity of the 12-year-old. Some will do that. Some won't. There are other treatments beside that, but if you want it fast and efficient, the shot is it. Takes a little bit longer if you use other methods.
There's probably an underlying curve there,
Mm-hmm.
and
Yeah.
as far as that concept of out and in, that doesn't really happen. If the spine was so weakly constructed that it was so floppy that things could just move all around, we wouldn't be able to stand. So if you take if you take X-rays of people, before and after, which we've had the occasion to do, before and after adjustments, they look the same. There is no difference. So nothing is
You can't really adjust
is
because.
out or in. Things are held tightly by ligaments.
Right. Yeah.
So you want to try to mobilize them, and through an exercise or something. But even trying to try to put something in or out. I mean that those terms, people use those terms. I cringe every time. We hear that because it's just.
I know it's
not
just street talk, Paul. I mean, they get away with it. My back went out, and I put it in. I mean, your hip was out. We put it in.
All out of whack. I like the way you said things. It's all out of whack.
Strange.
So Jane, if you want to call up Dr. Pannozzo, I guess you're from Florida, correct?
Yes, I'm in Palm Beach Gardens, and so is my grandson. But what I wanted to say is, when he was a baby, he fell down a long flight of stairs.
There you go.
There we go.
There it is.
Yeah.
And we had an egg, but it was a goose egg in his head. It was frightening. I remember. And,
Yeah. So you better try to get him in if you can, because we would take good care of him. We've seen this stuff before. I mean, it's all trauma, and you have to know how to handle it. And we have special films we do. The whole thing is just
Scientific.
100% effective. It just works.
So let me give you Dr. Pannozzo's number. It's 561-381-5800.
Yeah, we're getting more and more younger younger people in there, 12-year, 15-year-olds like this one, 10-year-old.
21-year-old,
we
yeah.
fix them all.
Yeah. Better get it done now while
A
they're
child
younger.
is no different than an adult. It's the same bone structure. It's the same ligament structure. So it's not something different.
Well, his family and myself were all into alternative medicine. So I've been listening to you for weeks now, and I just thought this is the thing for my grandson Bo. This has to be able to help him.
You have to be careful when you talk about alternative medicine. We do basic science medicine. Everything else is alternative.
Well, what he meant was, the normal doctor.
Yes. No, he knows what you meant. But again, the age is nice to know. He's 12.
Sure,
I've
yeah.
seen Dr. Pannozzo work with a 12-year-old in front of me.
Oh, they come out really fast.
Yeah.
If you know what to do, it's a slam dunk for these. The
They heal
younger
quicker.
you are, the faster they improve. I mean,
Yeah,
it's just
it's amazing.
The older you get, the more scar tissue you get. See, it makes it tough.
I've asked football coaches to have Dr. Pannozzo look at the players before they
Yeah.
play. I'm begging them. I was a coach for 21 years. I know what the problems can arise from the game.
Can you imagine somebody hiring a football player for $30 million a year and not even examining them, and then their knees go out?
Well, they shouldn't be
You know,
playing the game.
No,
I could give you examples.
It's just
That's amazing that he could tell you before.
Yeah,
what the
you
problem
could
is.
examine for that and figure out what's there so they don't get hurt.
Well, Jane, I hate to cut you off, but our show goes so fast that we're almost done. So, and Jane, all you have to do is call 561-381-5800, and you'll get Dr. Pannozzo on the phone right away, and he'll make an appointment for you. I hope we were able to help you, and we have the two of them here at the same time.
I will call either tomorrow or Tuesday.
Okay.
Fantastic, Jane.
Thank you for calling in, Jane.
Thank you so much. Dr. Paul and Dr. Tony,
Yes.
it is time for us to say
Goodbye.
I bid you a fond
See you later, Paul.
goodbye. Take care. Thanks for calling up. And to everyone out there listening, call Dr. Pannozzo, 561-381-5800. And thank you for listening. And all your dads out there, have a happy and healthy Father's Day.
I wasn't stumped one time.
No.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.
News, traffic, weather.